there's a special population of elderly patients, who are more vulnerable, or who we see are affected more by diabetes mellitus, so elderly patients. So what are the criteria or the guidelines in terms of using Glimepiride in these elderly patients? So as we age, as we progress, our body functions work at a lower level. That holds true for our brain, kidneys, heart, lungs, etc. But more importantly, the focus is more on the kidneys in elderly patients. So in case you are having any kidney disorder, which is basically diagnosed by your test like blood test or sonography and other x-rays, your physician will then initiate the dose of Glimepiride depending upon how low or high is your kidney function, and then he or she will monitor the kidney function and then accordingly adjust the dose of your Glimepiride tablets. Now, obviously, when you are taking a medicine to lower your high blood sugar, obviously it will cause low blood sugar. In medical terms, it is called as hypoglycemia. Anything hypo means low, glycemia means sugar, emia means something that affects the blood or in the blood. So hypoglycemia, the word means low levels of sugar or glucose in the blood. So therefore, if you feel that you are getting those symptoms of low blood sugar like giddiness, headache, or some palpitation here and there, and so be careful to carry some sweets or some candies in your pocket. So whenever you feel giddy or feel a headache, you can quickly take a candy or to ensure that you maintain your blood sugar levels. Now let's talk about how is this medicine taken. So it is generally recommended to take this medicine with your first meal of the day, which is ideally the breakfast, right? And it has to be consumed whole as a tablet. Please don't break the tablet, because then you will be taking a wrong dose. And take it with a whole glass of water. And the starting dose of Glimepiride will be decided upon by a physician depending upon your weight, your level of blood sugar, the time that you have been affected with diabetes, your family history, etc., your sedentary lifestyle, all those things, and whether you also have other illnesses at the time of diagnosis of diabetes mellitus. One important question might come to your mind is that what to do if I miss a dose. I realize in the afternoon that I have not taken the tablet in the morning. So if you are sure that you have missed a tablet, take it as soon as you remember. But be careful that it should not be very close to your next recommended dose, right? Once you take your first dose that you have missed, then please continue taking your next dose as per your doctor's recommendation. I would suggest that in order to not miss a dose, kindly we are using our mobiles for so many things. So you can use your mobiles to keep a reminder or keep an alarm so that it will remind you at that particular time every day to take your tablet, right? That will ensure that you maintain an optimal level of blood sugars in the body. Your blood sugar levels will not go up and down if you take the tablets on different times of the day every day. Suppose now it might happen that you might consume more than the recommended dose of those tablets in a day. What do we do? In case if you accidentally happen to consume more tablets, we would recommend that you contact your physician or contact your nearest nearest hospital immediately for advice and further treatment. Right? So these were some basic points about how to take the tablet and what to do if you miss a dose and if you take more dose.